Hi, I'm Sowmya. I'm a medical researcher from the Trobe University from Melbourne. So this is my presentation, the flow of my contents of my today's slides. So asthma is a heterogeneous disease characterized by chronic airway inflammation. So it's defined by the history of respiratory symptoms such as wheezing, shortness of breath, chest tightness, coughing, usually a dry cough at the night that vary over time and intensity, and together with variable expiratory airflow limitation causing airway obstruction. It's very common in young children to experience these lower respiratory infections, which even tend to cause wheezing in children. And in the children with asthma, the exacerbation of asthma is also very common. So this is my these are my study variables and these are my study participants, and many factors those contribute to exacerbation of these conditions in children, and it's very important to know that where we live in, and the key factor here for the causing all these changes here to be the environmental factor. So, giving an overview about my study here. So, the top on the left picture presents about the normal airway taken across the alveoli of the lung, and the second picture representing the asthmatic lung airway sectioned across the children. And when there is an asthma exacerbation occurring in children, the constriction of the airways causing the airway obstruction. So that leads to the difficulty of breathing in children, and they tend to attend to the hospital and get admitted. So, with exposures to different environmental pollutants or the environmental factors or the conditions, so we hypothesize that increase in hospital admissions is very common in this vulnerable population, and that's why I tend to look for around one of the environmental factor, that's air pollutants, and these are the five air pollutants that have been considered in my study. So particulate matter of size less than 2.5 microgram, particulate matter of less than 10 microgram, and nitrogen dioxide, sulfur dioxide, and ammonia NH3. So my research aimed to study the association between air pollution and daily asthma-related hospital admissions, including wheezing-associated lower respiratory infection, we shortly call it as WALRI, among children in Mysore city of India. So this, to just give an overview of the Mysore. Mysore is a district level a district located in the southern part of India, overspread across an area of 152 kilometers around, and it caters to a population approximately of 4.2 million population. My secondary aim was to assess these differences in effect estimates across boys and girls that have come into hospital admission, and across the, and very be specific to know about what's happening with the under 5 age group, so the young children and the older children. So because asthma is a bimodal pattern and it affects across the children and adolescents in a different pattern, so we just wanted to be specific in understanding what's happening in these two critical and vulnerable age groups. So coming to the methodology, we conducted a 5-year time series analysis of these daily hospitalizations at the as an outcome variable, and each of these five air pollutants as the primary exposure variables separately. And we modeled across these analyses using the generalized additive models to assess these association, and the models were adjusted for the day of the week, lag days, and we smooth these terms of time, maximum temperature, and relative humidity, and which were the meteorological factors, the effects of this climate that we consider for as an adjustment for in our models, and we again stratified by the age group and the sex groups to understand the further analysis. If the GAMS presented no effects, we stick down to the generalized linear regression models, and that's why we use the our software and Stata 16 software for completing all of our analysis in this study. Presenting to my results, most of the 64% of my population were boys, and about 50% of my study population was catered to be under 5 age group, and the prevalence of asthma was around 58%, and rest of the other 40% of the population had the wheezing. Continuing to summarizing these exposure variables, the PM 2.5, PM10, nitrogen dioxide, and ammonia, these are the 4 pollutants which I have included in my study and models. Though I have studied sulfur dioxide, because most of the measurements that were considered were within the detectable levels across the annual. So I have used the 4 air pollutants in my model, and these are the average values across the for the time series study, and it can be seen that it's across the in the range of low to moderate levels as per the National Ambient Air Quality Monitoring Standards in India. But if you look across the World Health Organization permissible limits, all of these pollutant levels are above the levels of the World Health Organization levels. And to again, when I looked to have and focus across the Mysore city, it was before I started this study. Mysore was was the cleanest city in India, and it was termed in the year 2016 and 17 as the cleanest city of India. So this is the table 2 presenting to summarize my GAMS for the daily asthma admissions or the WALRI. Seeing to the column second of this variable, we could see that the NO2, PM2.5, and NH3 have a nonlinear effects. And the column 3 presenting to the boys, most of the boys driving these association. To explain up to the bottom row of in this table, that is NH3, the ammonia, you could see the values are higher, the effects are higher, and the range is wider, presenting to the might be the volatile nature of these associations of this pollutant. So coming to the next table 3, this because PM10 was only had nonlinear effects among the boys, whereas overall all the participants with on exposure to PM10 presented with the linear association. So we presented this, we did the linear regression model, and PM10 presents to have a linear effect with respect to all the participants. Summarizing my results, GAMS showed nonlinear association between NO2, PM2.5, and NH3. For example, to present, it is like 10% increase in NO2, increase the admissions by 2.42. So these nonlinear effects were more pronounced in boys, and a linear effect was detected in PM10 with a relative risk of 1.028 with admissions. To conclude, we observe increased risk of admissions for asthma and related conditions in children and adolescents with increased level of traffic-related pollutants and ammonia, especially in India, where it's increasingly becoming a problem. In Mysore, India, all the pollutants are above the World Health Organization air quality standards, but less than or equal to National Ambient Air Quality Standards of India. The effects of NH3 may be detrimental. There are very few studies have been studied about this, the rising of these air pollutants. So to my research implications that I want to discuss here. So my study provides further insights into this growing problem of environmental triggers influencing respiratory related conditions in children and adolescents. Air pollution needs to be carefully monitored, and the policy to focus on lower cutoff levels for the vulnerable populations are necessary. These are the references I use for these presentations. Thank you very much.
Thank you.
Thank you. Thank you.
Questions? There's one over there.
Thank you for the presentation. Would like to ask, according to you, what could be the reason for the gender differences that we observed in Mysore city of India?
Gender differences.
Because you are saying that boys are more affected by PM2.5 pollution.
Yeah.
Yeah. So what could be the reason behind that?
Yeah. If you think about the physiological nature of the thing is that the boys tend to have naturally a lower lung size, lower for their appropriate for that age and specific, so that they breathe more lungs, they breathe more air. For the breathing rate is more higher in boys, and though even if the pollution is more, they inculcate more air inside them. And the physical activity, boys seem to be, maybe we propose that, like boys seem to be more physically active, tend to be exposed to the exposure of external factors to be more in these young and adolescent age groups. Maybe that might be the physiological affecting factor causing through it. But if in case of my study modeling, which I look about, so these tend to be like the reporting to the hospital admissions, maybe because of the post effects, or it is, and I could see that the admissions were higher in boys. Hospital daily admissions were higher in boys, and and the repeat admissions. My further study looked into that. The repeat admissions even tend to be higher in boys. Yeah.
Any other questions?
Thank you for this report. As it is known from literature,
So,
there is, as it is known from literature, for instance, books of Bircan, there is a synergism effect of sulfur dioxide and particles. So it means that if they exist simultaneously, the damage is much more for the health than for each of them alone. Did you study this effect of synergism?
yeah. Um, the current model, we looked into the minimal adjustment because this is the first study that's happening all across there in this region. So we took to a minimal adjustments and we studied this in model. So when we look into the dose related effect, the change in exposure variable, how it's impacting the change in the admission or the risk in the admission, you mean to say that. So we would look forward to study with respect to the higher digital simulation models that were being explained today, or the Bayesian network. So this is not the causal or the effect that we would be looking at, sir. And I think we could look forward to the dose related response. Especially in this study, we plotted for the smooth plots to look forward to what exactly you mean for the synergistic effects or something. And the smooth plots presented like at the lower levels of these concentration levels, if all the effects of these air pollutants were linear, those effects was linear with increase in admission, with increase in air pollutants causing increase in air pollution. But at the higher levels, when we went to the higher concentration levels, the admissions tend to be different. For example, NO2 at peak concentration levels, we had the least admissions. So there might be the lag, that effect that's might be happening. So we would like to study that across more in further models.
Any other questions?
One more.
Thank
Does
you.
the result mean that boys needs more attention for their health than girls?
Yeah. Yes. Yes.
Last question regarding the air pollution indoors. Can you take that for account?
Um, Yeah, no, sir. I think this is the in my study. I only look after these air pollutant concentration at the ambient pollutant levels. But the indoor air pollution exposures we did not cross. Most of the studies that I come across having both the indoor and the outdoor estimation methods might tend to be interference in the model or interactions in the model. So it's possibly this is first I want to look into the external cause of the factor. Maybe yeah, that's one.
Because like 90% of the time we are indoors, not outdoors. So
Um,
I think,
yeah, I think that's true. If you have come across to the younger age group, the under less than 3 years age group, you can see that they're most of the time they are even more at the indoors compared to the other population, my other study population above 5 age groups. That's what I studied. So, but yeah, that tend to be more. But I think if I am taking it across the module this study, I haven't considered those models. There might be implications of that. There are studies that have household-related air pollution and decreasing, and there are other parallel studies we are running through across with respect to carbon monoxide exposure in the indoors as well. Yeah, and PM 2.5 is having a major effect, and that's a parallel study, and it's a 10-year cohort study that's been running at the same hospital we are doing at that. Yeah, my dream.
thank you very much.
Thank you.
So,
Thank you for the presentation. I have a question on the breakdown of the particulate matter, if you have any data about it. So, if you know if it's dust, how much is blood carbon, how much is soluble blood carbon, and if you see any effect on the different types of particulate matter on asthma.
How each of the
Yeah, if there's any information available, I'm not a neuropolitical person and another doctor, so it's just out of curiosity if you see any difference depending on the type of particulate matter, whether it's soluble carbon, non-soluble carbon, or other types of dust, that if they create different level of risk.
Oh, yeah, absolutely. Thank you for the question. I think when we speak about the PM 2.5 PM particulate matter specifically, so I think the most of the PM 2.5, why I studied PM 2.5 and PM 10 here specifically because of that reason. PM 10, it filters at the upper stage above the lungs, and PM 2.5 being more finer, it seeps to the deeper part of the alveoli. So the blood concentration level of PM 2.5 enters into a very cause a higher concentration level. PM 10, while it gets filtered at the higher level at the higher part of the lung itself. So the effects are more pronounced with PM 2.5, while the effects are more pronounced with the higher size of the particulates. So just to compare it here, that's why maybe because in that the purely PM 2.5 presented to be more nonlinear effect, a wiggly kind of effect, like when the concentration higher, maybe the admissions increasing, when the concentration lower, it may be differing. So, but with PM 10, it's very clear that with increasing the higher particle size, that is going to increase your admissions. It's very straight. So it means that different kinds of particulate matters with different kinds of sources might be, for example, maybe the dust or the emission due to the carbon combustible sources, or the vehicular emissions might choose to be affecting even the children differently. So we would further like to study to be more specific across the sources and their effects. Yeah, thank you. Hopefully, I'm part of that. Yeah, your answer to you.
Thank you.
Thank you.
any question for any of today's presenters, any of the four presenters? No? that case, thank you very much for all our presenters. Thank you.
Thank you very much.